Yes, Sanjana, we can hear you.
Any doubts from the citizen side? Do we have any citizens today? Okay, we have one question from the chat. So ಇವತ್ತು ನಮ್ಗೆ ಒಂದು brainstorming session ಇತ್ತು as to how we can achieve zero deaths in Bommanahalli ಅಂತ. So I request one of the ward special officers to give one brief understanding about how we could achieve this. ನಿಮ್ಮ understanding ಅಲ್ಲಿ whatever you can understand, can you please ಹೇಳಿ? Am I audible?
Yes, you can be heard.
Okay, so first of all, I'll just brief about how we are operating in Bommanahalli, and I can just give you a brief account as to henge we are planning to ensure that there are zero deaths in Bommanahalli. So first of all, we have the entire Bommanahalli zone that is divided into two constituencies. Adralli, we have 16 wards, and we have senior KS officers heading each constituency. Amele, we have our KMS officers who are present today in the meeting, who are heading one ward each. And all the field operations are taken care by our field ward special officers. The field operations are ಏನಂದ್ರೆ swab test drives conduct ಮಾಡೋದು ಅಥವಾ ನೆಕ್ಸ್ಟ್ ಕಾಂಟ್ಯಾಕ್ಟ್ ಟ್ರೇಸಿಂಗ್ ಮಾಡಿಸೋದು ಅಥವಾ ಯಾರು ಪ್ರೈಮರಿ ಕಾಂಟ್ಯಾಕ್ಟ್ಸ್ ಇರ್ತಾರೋ ಅವ್ರನ್ನ ಹೋಮ್ ಕ್ವಾರಂಟೈನ್ ಅಲ್ಲಿ ಇರೋ ತರ ಮಾನಿಟರ್ ಮಾಡೋದು. ಆಮೇಲೆ ಹೋಮ್ ಐಸೋಲೇಷನ್ ಯಾರಿಗೆ ಸಜೆಸ್ಟ್ ಮಾಡಿದಾರೋ ನಮ್ ಟೀಮು ಅವರು to ensure that they are under home isolation. So these are all the field operations and these are all taken care by our ward special officers. ಆಮೇಲೆ central level at the zonal level we have our Bommanahalli helpline that is active 24/7. Idir jotege we also have our central triaging team. So we have a team of doctors who are working in 3 shifts to ensure that the people are triaged and they reach the ideal COVID care center or hospital or home isolation ಅಂತ suggest ಮಾಡೋದು ನಮ್ಮ shift doctors. So this is how we are operating, and we have ward war rooms which are set up at every ward, and we have a central war room which is also present in the HSR BDA complex in the second floor. So we've also given out an invitation to all the citizens who want to come and visit our war room. And we are all connected by ham radios, all the ward war rooms and the central war room. So this is our structure. So we want to ensure that there is zero deaths by tackling 3 aspects. So the first aspect is confidence building measures. Ivaga, first of all, you people as citizens should trust us because we are also working towards ensuring that that this disease is curbed and we cut the chain. So we want you to trust us and we want you to actively participate in these conversations to understand nim kadeyinda enen problems ide athwa what is that, any doubts that you are facing, anything, any queries, any suggestions, any ideas yene idruno. This is one platform where we have officials, we have volunteers, we have doctors on board who can actually help you understand how we are operating, and any kind of suggestions you want from our end we can provide. So please make sure that this platform is used. The next most important thing we have to ensure is sir, any of the ward officers want to include anything, can include. Manasa ma'am, Venkatesh sir. I just don't want to be the only one talking. Anyone can brief. Okay. Okay, we'll just take up one or two questions, then I'll continue this. Anyone there with any of the questions?
Ma'am, do we have any doctors in the panel today?
Just 1 second, sir. Just give me a minute, I'll ensure one of our doctors convert. Sumuk sir will actually continue and we'll elaborate on how we are planning to end deaths in Bommanahalli. After that, I'll make sure there is one doctor on board. Sumuk sir, over to you.
Hi everyone. Yeah. Any questions that were there specifically?
Sumuk, they are asking
Sir.
about isolation. After isolation, is there any testing? There are few questions in the chat box.
I'm sorry, I won't be able to see the chat. I just joined now. So the question is, once a person is home isolated, is there a test at the end of it, right?
Yes, Sumuk.
Okay. So by end of home isolation,
Yes,
there is no test.
Sumuk.
Once the person crosses his 14 plus to 17 days of isolation, then he is allowed to go out. So the isolation ends on day 17. Post day 17, they need not do a test. So once they cross the day 17, they are deemed to be cured. I'm sorry, was I audible?
No.
Sumuk, not clear. It is cutting.
The last sentence.
I'm sorry. So once the person finishes his 17 days of isolation, right? 14 plus 3, 17 days of isolation, the person is free to move around. So he need not go get another test now.
No, within 14 days. Within 14 days, testing is required.
No, within 14 days,
panel. So once he gets a
within
positive,
14 days is also, it's not required. There is no repeat test that is required. Once a person is considered positive, it is positive. So see, what happens is more number of times you test, right? In the system, you'll be registered saying that you have turned positive on that particular day. So it might end up becoming that, you know, you will be put under home isolation for 14 more days from your last date of test. So it keeps going on and on. So that's not recommended.
but one thing, if tested, which gives the instant result.
Sorry, Girish, your voice was not clear, Girish.
Okay, okay. I test in the chat box, and let's. There are many civilians who have joined.
I have two questions in the chat box. So one is, will BBMP give a letter? Yes. So you can go to a PHC and take a fitness certificate at the end of 17 days. So you visit any of the PHCs, you give them your SRF number and date you turn positive. Based on that, the local PHC, whoever is the government doctor, he will give you a fitness certificate, which you can show in your workplace.
Does it need an appointment before going to the PHC, or it's a walk-in?
No, you don't need an appointment to go to the PHC, but in any case, just to confirm the time, you can call our helpline number and they'll coordinate it for you. So you can call on 888-466-6670. They'll talk to the PHC doctor and confirm it to you.
Okay.
Anyone? Sumukh sir, can you please share the plan that we have for controlling the deaths in Bommanahalli?
Yeah, I'm sharing it. Okay, I hope the screen is visible for everybody.
Sir, can you please
Yes.
zoom it a little?
Yeah, so see, the plan is like this, right? I hope everybody can see it. Until now, we were doing mass testing camps in different places. So now we have changed the strategy a bit, because we did the mass testing camps at least 2 rounds in almost all major places that is required now. So in the last 20-25 days. So now we are changing the entire strategy a bit, right? So our testing happens in this way now. One is the PHC is open from 9 a.m. till 3 p.m. All the PHCs are open. You can walk into any PHC at any of, between 9 a.m. and 3 p.m. and get yourself tested. Second is, we are setting up testing in all the industries. We have more than 100,000 workers in different industries working. So we are setting up testing for all those in all those industries, basically, just to make sure that there is nobody who's infected there. The third testing happens is, which is basically mobile testing. So we have 16 Omni vehicles which are converted into testing, mobile testing kiosks. So these vehicles will go to all the primary, secondary contact houses, houses where home isolations are there, and test all the family members and all the primary, secondary contacts. So any of the primary, secondary contact or the home isolated family members, so generally our people will come and approach for the test. If somebody has not come, or if you want to get tested, you can call our helpline 888-466-6670. You can call our helpline. We will send the mobile testing vehicle to your place. And the fourth testing option that we have is, in case of any emergency, right? So if there's a medical emergency, you need to get admitted to a hospital, you don't know whether you're positive or negative, the hospital is asking for a negative report, all these things are there. In this situation, you can call our helpline anytime in the day. So 24/7, we have 8 vehicles set up as of now, 4 ambulances and 4 two-wheelers, where our swab collection agents will come to your place and conduct a test within a couple of hours from your request. If it's a dire medical emergency, please mention that there is a medical emergency, so that we can immediately divert the resources from other places and we can get the test done at your place. Also, if it's in case the rat test comes negative and there is a medical emergency, we have TrueNat machines that have been donated to us by Azim Premji Foundation, which we have in 2 PHCs. We can conduct immediate TrueNat tests, which is considered equivalent to RT-PCR, and we can give you the results. So this is the testing mechanism that we have set up now. So the entire plan is like this, right? To stop the death. So our goal is to make sure that by September 15th, COVID deaths must stop. Presently, if we see, more than almost 50% of the deaths, COVID deaths that have happened, we found out that the person had COVID only after the death. So when once a person once a person is deceased, then our junior health inspector or somebody has gone and has done a swab test on that person within 6 hours of his death, and that is when we discovered that the person had COVID. So we want to avoid that situation. To avoid that situation, the best way is to make sure that all of us monitor ourselves and we monitor the people around us. So the first thing that we need to do is monitor, oxygen saturation. Especially give attention to those who have comorbidities or symptoms. So SARI, ILI symptoms, comorbidities for these people, and in general also, everybody must please, just keep a tab on their oxygen saturation levels. So to keep a tab on oxygen saturation levels, all you will need is a pulse oximeter. If you can afford one and buy one, please go ahead and buy it. It costs roughly around 800 or 1000 rupees in any shop. If you can't afford one, ನಿಮ್ಮಲ್ಲಿ ಯಾರಾದರೂ ದುಡ್ಡು ಕೊಟ್ಟು ಖರೀದಿ ಮಾಡ್ಲಿಕ್ಕೆ ಆಗಲ್ಲ ಅಂತಂದ್ರೆ, call our helpline. Say you have some aged person or somebody with comorbidities or somebody with slight symptoms or anything, but you can't afford a pulse oximeter. Please do contact our helpline 888-466-6670. We will get one pulse oximeter delivered to you. Again, we have got a large number of pulse oximeter donated by Azim Premji Foundation, which we can give it out to you for a set of certain number of days. And once you feel better, or if there's a aged person, we can also leave it at your place so that you can keep monitoring your oxygen saturation levels. So this is the first thing that we want people to do. Spread the helpline number more and more amongst your friends and peers, so that even with the slightest symptoms, you guys call us so that we can immediately come and test. So the thumb rule is like this, right? When in doubt, get tested. Don't think that I might not have COVID. If you have a doubt, if you have symptoms, if you think you have come in contact with somebody who has COVID, come to us, call us. We will immediately arrange a test either at the PHC or at your home. Get tested, because once you get tested, right, in the early days, if you get tested, there is no possibility that your situation will worsen. You're already under medical care, you're covered, required medicines are given, and we are equipped to serve you. So when in doubt, get tested. That's the thumb rule, right? So that's the first part to avoid death. So other activities that we are internally planning is, we have also found that there are some delays in test results that we are assessing. Those who are symptomatic and are at home, we are trying to do survey from our PHCs and test them. We have also observed at some places that even after joining the hospital, certain cases of death have been reported. So we are now working with hospitals to analyze why the death happened, so that if there is any better medical treatment that could have been given, like plasma therapy or any other therapy that could have been given, if it was not given, we want to correct that also. We want to make sure that every single person gets the best possible treatment and he recovers from COVID. That we are working on that also. We also want to make sure that we understand that the trust level are quite low. So there have been rumors that are going around. Some cases there have also been errors that are found. So there is huge trust deficit between the government and the public. So to cover up this trust deficit and make sure that we work together, we want to build the confidence of the society. So we will make the entire system transparent. Now we are coming up with a website where you will see where our PHCs are there, what time it is open. You will see our ward offices. We will put out our live dashboard of every single case that comes in to us. We will also put out our ambulance tracking link open so that you know where the ambulances are stationed. So right now we have 98 ambulances in our zone, which are stationed in all 16 wards spread out. So at any given point of time, if there's a COVID emergency, we can reach you in like maximum 10 or 15 minutes if you provide your address correct. So from our side, we are trying to do as much as possible, as much as transparent as possible, so that you also get a good amount of confidence in the government. So clubbing all these efforts together, we want to make sure that the death rate comes down to zero. So we want to make sure we detect every person with COVID and we take proper care of those persons so that the deaths can be avoided and it comes down to zero. So if you have any questions regarding this, you can go ahead and ask now.
Like the helpline number for the war room that you specified, are there any helpline or contact number at each ward level that okay, for a specific ward, if we want to call them, and are they reachable? Like, do we have any such setup?
No, sir. For the entire zone, we have a common number. Please call on that number. The concerned ward officer or whatever query you have from the ward office, you will get a call back. Not an issue. We have one common helpline number. Please call on that number. You will immediately get a response.
Okay, thank you.
Hello. Hello.
Yeah.
It's Girish here. To my citizen friends, those who have participated in this meeting, so I request them. The first thing is because what we are observing especially in the apartment, they are hesitating to get tested. Maybe that is because of the stigmatization, social stigmatization within the association of apartments. Getting tested, it gives you a kind of confidence. So I request those who are staying in the apartment, my citizens friends who are in this meeting, they have posted regarding the apartment association also. So testing, especially those who are staying in the apartment, it gives you a more confidence, and we have to reveal it immediately. We have to reveal it if a person is a positive. Immediately we have to reveal, because you might have observed so many celebrities and politicians, they are revealing themselves that I have got positive. So those who are in my contact, near contact, you please get tested and take a safety measure. So this should happen with the common man also. So ಯಾರ್ಯಾರು ಇದರಲ್ಲಿ ಅಪಾರ್ಟ್ಮೆಂಟ್ ನಲ್ಲಿ ಇದ್ದಾರೆ, ಟೆಸ್ಟಿಂಗ್ ಆದ್ರೆ we can control the rate of spreading and also death rate also. ನಾವು ಲೇಟರ್ ಸ್ಟೇಜ್ ಅಲ್ಲಿ ನಾವು ಡಯಾಗ್ನೋಸ್ ಆಯ್ತು ಅಂತ ಹೇಳಿದ್ರೆ ಅದು ಸ್ವಲ್ಪ ಕಷ್ಟ ಆಗುತ್ತೆ. ದಟ್ ಈಸ್ ಟು ಏಜ್ಡ್ ಪರ್ಸನ್, ಎಲ್ಡರ್ಲಿ ಪರ್ಸನ್ ಇರ್ಬೋದು, ಮತ್ತೆ ಸ್ಮಾಲ್ ಕಿಡ್ಸ್ ಆಗಿರ್ಬೋದು. ಲೇಟರ್ ಸ್ಟೇಜ್ ಅಲ್ಲಿ ಐಡೆಂಟಿಫೈ ಆದ್ರೆ ಕಷ್ಟ ಆಗುತ್ತೆ, ಜ್ವರ ಬಂದು ಸಿಂಪ್ಟಮೆಟಿಕ್ ಆದ್ಮೇಲೆ. ಬಟ್ ಅರ್ಲಿ ಸ್ಟೇಜ್ ಅಲ್ಲೇ ಟೆಸ್ಟ್ ಮಾಡ್ಕೊಂಡ್ರೆ ಡೆಫಿನೆಟ್ಲಿ ವಿ ಕ್ಯಾನ್.
Thank you, Giri.
Yes, sir. Thank you, sir.
Thank you, Giri, sir. Any other questions from anyone?
Do we have anyone from the citizen side? Any questions, queries, doubts, suggestions?
So I have one question. Like from the data that we have from Bommanahalli or from Bangalore or for a larger sample, are there reoccurrence of this infection to anybody once he has recovered from the disease? So are there any such cases reported or received?
Okay, see, here is how it is, right? So when I say reoccurrence, what matters is in what timeline it happens, right? So generally, we have found that, studies have found that when you do an RT-PCR test, a person is found. So when a person is declared positive, it means that traces of virus was found in his saliva or in his discharge, basically. So when certain researchers have come up and told that even on 20th day, 25th day, 30th day, there have been traces of virus that is found in the RT-PCR results. But that essentially doesn't mean that he can be a spreader. So there have also been studies which, see, it's a dynamic situation. The study is going on, new, things are coming out day by day. So, but the present report and the present study says that after 14 days, the person cannot spread to others because his viral load is almost low and he has antibodies developed in him. When it comes to reoccurrence of case, we don't have a specific set of things about reoccurrence of a case. Most of the times it has happened so that a person has turned positive and then he has gotten himself tested after 10 days again, and then after 14 days again, and then traces of virus have been found again. But reoccurrence of a case, say for example somebody who recovered a month ago or 2 months ago, he has turned COVID positive again, we have not found any case as such till now in our zone.
So a related question. So you were talking about the antibody formation. So are there any tests done to access the antibodies, whether it is formed in the body or something? Are there any such tests also available?
Yes, those tests are available, and it is available in private labs. It is also available in government labs such as Kidwai. So you can go and get an antibody test done. Specifically, the government is not doing it by itself. So we are doing only COVID tests, which are 3 types of tests basically. One is rapid antigen, second is RT-PCR, and third is TrueNat.
Okay,
Anybody else have any more questions or queries? Do we have any more citizens who have any queries, questions? So Sumukh sir has actually explained the fishbone diagram and how we planning to curb the disease and ensure that there are zero deaths in Bommanahalli. So regarding this, do any one of you have any doubts or any suggestions how we can actually make it more effective? Can please come forward and tell.
Hello. Hello.
Heli sir, Heli.
Yes, yes, please go ahead.
Yeah. Go ahead, sir.
Hello.
Go ahead, sir. Go ahead, sir.
See, in some places that.
I'm sorry.
Hello. Hello.
Yes, ma'am. Go ahead.
In some cases.
Ma'am, you're audible.
You're not audible.
Audible, ma'am. Audible.
Some places I've heard the testing results come quite late. It should be, rapid, because some places even 10 days later they get the report. Meanwhile, they would have gone all over the place and spread the disease.
Ma'am, thank you for pointing this out, ma'am. I do agree that there were delays in tests from our side, and we apologize for that. But there were various reasons attached to it on why there were delays. We have now fixed all the bottlenecks that were there, and we are targeting for getting the results within 24 hours. But in any case, in the last 4 to 5 days, whatever tests we are doing, we'll get the result within 24 to 36 hours. We have also appointed special officers who will sit in the labs and get the work done and get all the results done. So from our side, we are fixing that problem, and it is fairly fixed now. Please do get in touch with us if there is any delay on any specific case. We will follow it up and we'll get back to you on the results. But the bottleneck that was there and the problems that were there have now been solved. We will keep improving the system, ma'am. Thank you.
Basically, I'm a doctor. I am working with that step 1 fresh desk. So we have come across quite a few cases, not primarily from our wards, but a lot of people, either the test is done long back and now they get it as positive. The other thing is, somebody would have told them negative, and then later we say they are positive, so they don't believe us that they are positive. But we are sure, because our tag is with ICMR number, we know that they are positive, but then they don't believe because they have been told by somebody that is they are negative.
Yes,
So
ma'am. I
these
realize,
kind
ma'am,
of
this
things-
problem was there for 2 specific reasons, ma'am. One is once a person is symptomatic and they do a rat test, and if the rat test comes back negative, they take a second sample for RT-PCR test. So the person would fix in his mind that he is rat negative. So by the time the RT-PCR result come, if there's a delay, and then we go back and tell him that he's positive again, there's a confusion for him basically. So to end this confusion, we have told our PHC doctor specifically to tell people that once a second test is taken, they should be educated that the result of the second test might be different from that of the first test, because the accuracy of rat test is not as good as RT-PCR. So that's the reason an RT-PCR test is also done on symptomatic rat negative patients. So in these cases, this confusion is there. We are trying to solve it. One error that was there from our side, where a same SRF was used for both RAT and RT-PCR, is now sorted. From now on, different SRF IDs will be generated so that there is no confusion regarding the report for the same SRF being negative and positive both. So that is now solved from our end. When it comes to delay, as I informed you, ma'am, in whole of Bangalore, the testing capacity is almost doubled in the last 10 days. The system is being improved more. So we should be getting results quicker in the future, ma'am.
Anyone else who has any questions or queries?
My one request to all the citizen friends is that please spread the link of this Zoom meeting widely to all your friends, family members, neighbors, your apartment associations, or your sports club, or whichever activity that you take part in this zone, because we want more and more input from the public to improve our system. We want to get a feedback. We want to know where we are failing so that we can fix it up and we can serve better. So my request to all of you is to please spread the link of this Zoom call that happens every day between 5 and 5:40 to a larger group that you know.
One more thing I would like to say, especially when you're doing testing at industrial level, I think correct information should be given to all the employees, because today I had one KSRTC person. He was tested long back, and it was at that time he was told negative, but in the fresh desk he was positive. When I told him, he didn't believe. He said his department people asked him to go for again testing, which was not really required. So this kind of proper information at industry level, when you're testing quite a few people, if correct information is given, confusions can be less.
Sure, ma'am. We'll take it into account. We'll also have a leaflet or something that is printed in this regard. We'll also tell people that they need to be home isolated until the results come out. So we'll take the suggestion into account and we'll immediately take action on that, ma'am. Thank you so much.
And also another thing is, when people are taken for CCC or hospital, the people should be explained what is the reason, because a lot of resentment is there saying that BBMP is forcibly taking them when it is not really required, because they don't understand if they're alone they have to go to CCC, or if they're elderly beyond 60, even if they don't have symptoms, they can develop symptoms at any stage. Some information, basic information, if it is given, this kind of false or wrong notion can be reduced.
We will do it, ma'am. We will create more and more awareness. That's a part of the strategy that we have worked out, because once people are aware, 50% of the problems get reduced, because they know what happens after each step. So we will create more awareness. We will also try to talk to each patient in a way where the patient understands. We'll take your suggestion into account, ma'am. Thank you.
Okay, thank you.
Do we have any more questions?
Madam, there was a tweet from Bhaskar Rao sir about a plasma bank set up in Bangalore. Can you just throw some light on that? Basically, like if a person who has already recovered, whether how he can donate, or if there is a process for that, or number of days he has to wait for that. Any information on that?
Sir, at this point in time, I don't have specific information about that. If you can post your phone number on the chat, I'll ask somebody from my team to get more information and send it. Or alternatively, I'll ask my Twitter team to post the entire details about this plasma bank by today, end of the day. You can follow us on Twitter and you'll get details about this, sir. We'll get information on this. At this point, I don't have complete information about this with me.
Okay, thank you, sir. Also, when you are talking about Twitter, can you ask the team to post, like as you were telling that after 17 days a person is deemed to be, okay. So those information are still not very clear with all RWAs, and people do question about, a lot of fitness clearance and all. If this information is put on the Twitter handle from your Bommanahalli COVID helpline, that would greatly help to, clear this confusion among people.
Sure, sir. We'll do that, sir. We'll have a small poster or something designed for this, and with all the required information, and we'll post it shortly.
Yeah, especially for the post-home isolation, what I'm talking about.
Got it, sir. We'll do it. We'll do it, sir.
Any more questions?
In fact, yes, if people realize that there is no need for retesting, a lot of money can be saved, because people unnecessarily go for retesting at the end after 17 days. Again, at the end, if the company demands again, I have had people going for third time test, which is waste of money. I think it should be publicly publicized.
We'll do it, ma'am.
Sure, ma'am.
We'll do the best possible from our side. We'll do it.
Do we have any more queries?
So thank you everyone for taking part in today's COVID conversations. Please do spread the news about this conversation that happens every evening between 5 and 5:40. If more and more people come in, they give their suggestions, ask their queries. It will help us work more efficient and deliver better services. We are here and we are open for all your suggestions, and whatever improvements or information that you require from us, we are open for that also. So please do spread news about this. Thank you so much, for participating, everyone. Have a great day.